Nearly 3 million Americans are living with atrial fibrillation, a quivering or irregular heartbeat.
Now, many times it can be controlled. In Health Watch, Shelley Botat tells us how doctors treat the condition when the best remedies fail.
Bernie Larson has atrial fibrillation. Over the years, before meeting Dr. Sheikh, she used medications and had multiple ablations to control this rhythm problem. Bernie's disease progressed to permanent Afib, so she needed a different type of pacemaker to control her symptoms. 70-year-old Bernie Larson is back in the swing of things now that she has the energy to hit the ball.
Oh, a lot easier. I can walk a lot easier now and not be short of breath.
Bernie was diagnosed with atrial fibrillation when she was 50. Over the years, she's had multiple procedures and medications, but couldn't regulate her condition.
Unfortunately for her, we tried ablation procedures in the past and other medications to try to control the atrial fibrillation, but for her, she would revert back to atrial fibrillation.
Then her symptoms came back.
And last summer, I was noticing short of breath and swelling and kind of hard to walk.
And it was keeping her from enjoying life.
I didn't have a lot of energy, and just, steps were mostly the killer, or just trying to do a lot of everyday stuff that requires more energy.
So she went to see electrophysiologist Dr. Sheikh at Aurora BayCare Medical Center, a cardiovascular disease specialist.
So atrial fibrillation is basically chaotic electrical activity in the heart. It can cause symptoms of palpitations, jitteriness, anxiety, and it can cause heart failure.
Which happened in Bernie's case.
She developed cardiomyopathy, which means that her heart function decreased. And that can be blamed for her symptoms of shortness of breath, fatigue, exercise intolerance.
Dr. Sheikh recommended upgrading her pacemaker to a biventricular pacemaker with 2 leads placed on the bottom of each side of the heart.
So that's over here. So she has a wire here, then she has a wire on this side of the heart. And so that's how you can pump with more efficiency. Right ventricle, left ventricle, and now we pump with synchrony because you have 2 wires controlling the pacing of the heart.
Keeping Bernie's heart pumping despite her permanent AF rhythm and back to doing the things she loves. If atrial fibrillation goes untreated, it can cause stroke, heart failure, or severe debilitating symptoms. To learn more, you can call Aurora BayCare or email HealthWatch at aurorabaycare.com. And that's your health.